I didn't know it at all. Hey guys, so Jenny asked a question about irrigating a wound. Do we ever irrigate a wound? So I'm going to show you how to irrigate one of these wounds. We irrigate them all the same principle, okay? Which is we irrigate to the amount, this is in carbon, so these three lines. To the amount of solution that is ordered is given, to a runs clear, or the amount of medication. We do not irrigate to debris. We do not irrigate to debris. Irrigation does not debride a wound. Irrigation is to cleanse a wound of exudate, which is a fancy word for drainage. Where did that go down? So let's say that either we have an order to irrigate or we decided we're going to irrigate this hip wound. Okay? We always want to irrigate from top to bottom. Now that gets tricky because what position is your patient in? So this patient is prone. Patient is now supine. Patient is now standing. Patient is now in transnullified position. So top to bottom can change depending on what patient's position they're in. Does that make sense to you guys? So we always irrigate top to bottom. Like you would never wash the bottom of your car than wash the top of your car, because your bottom of your car is just going to get dirty again, right? Some people are like, well, that makes a lot of sense. You start washing the top first.
Or you start washing it, period.
That's a good idea. So we always want to watch top to bottom, or superior to inferior, but that depends on the anatomical positioning of your patient. You guys okay with that? And then to irrigate in an irrigation tray. You guys all have an irrigation tray in your kits. So after I do this, it's going to take me about 45 minutes to get through these two things. Then we're going to give you guys the next 45 minutes to practice both of these things.
Okay.
So whenever I open up the sterile, so I'm going to do this sterilely. And even though in the hospital we don't have to do it sterilely, it's one of those things that it all comes sterile anyway, so I might as well do it sterile. So I do irrigation sterilely all the time. Not because I have to, but just because it comes that way and it's going to decrease the risk of an infection. So whenever I open up any package, okay, I make sure any sterile package, I check three things. The color. This seems like it's not sun changed. It'll get yellow if it sits in the sun too long. That would say that it's no longer intact and it shouldn't be doing its job. Whereas I have my little lips I can grab, it's intact. So it's not, the color is normal, it's intact, and the expiration date, 20/20/11/28. Okay, so I got a whole another year before it expires. So look at the expiration date and make sure it's intact and make sure the color is appropriate. Once I do that, then I'm going to go ahead and open it up. Guys, we always want to open up things towards us, never away from us. If I open up this way, as I reach over, you're going to have to reach over your sterile field sometimes, but we try to avoid it. Okay. If I reach over it, something from my arm could fall into the sterile field. So that's why we always open towards us, so because as I'm opening, then this is protecting the sterile field from my body. Does that make sense? Some nurses will leave this like this attached. Not me. I take every package wrapping off. I don't need that anymore. I also am a big believer that things that I'm not going to use, I get rid of. Okay? Now, once I have a sterile package open, I got to keep eyes on it at all times. If I take my eyes off of that, I don't know what happened when my eyes were away. I don't know if the patient sneezed on it. I don't know if they coughed on it. I don't know if the kid in the room threw something on it. Okay? I don't know if the magical dust bunny threw something on it. Okay? So I got to keep my eyes always on the sterile film. Okay? Now this is going to be a little, right now, you guys agree everything in there is sterile? I'm purposely going to grab this. This outside of this is no longer sterile. The inside of this is no longer sterile. You see that this comes with a cloth for irrigation. It has a shiny and a non-shiny side. Non-shiny, shiny. Okay, see the slight difference? What side goes towards the patient?
Non-shiny.
The non-shiny goes towards the patient. The shiny prevents the moisture from going through. The non-shiny will absorb the moisture. So I've already put a chucks underneath my patient, which is what I normally would do. But if you want to use this one, you can. Okay. And then this is a collection container so that I can have my colleague hold my patient so that it collects the fluid, so it doesn't just go onto the chucks or into the drainage pad. That's square. I like that one better. So I like to get my kidney basin when I'm working with my hips. Personal preference. Okay? Is okay with that so far? From there, do we agree that the outside of this is no longer sterile?
Yes.
Okay. So I'm still going to do this sterilely, and I don't have sterile gloves on. Okay? I have a sterile package. What am I going to check it for? Date,
Intact.
color, intactness. expires 2021. The color seems appropriate. It is not yet opened. I can feel because I'm going to crack it open right now. And it has the seal still in place. Once I open up fluid, it is sterile for 24 hours as long as I time, date, and initial it. Fluid is good for 24 hours as long as I time, date, and initial it. I always cleanse the lip, whether it's a new package or one that's already been opened. I always cleanse it over top of the label so I know where I cleaned it, right? Because if I clean it like this, I always say pour out a little bit for my homies. For those of you that are old enough to remember that, you know what I'm talking about. Some of you are like, what is he talking about? It's an 80s rap. No, probably 90s. It's not a 40, and you're right, Dave, it's not a 40. Yeah, I need to get a 40 to do it properly, okay? So then what I'm going to do is that's still sterile inside, right? And the inside of that's sterile, so I'm going to pour my sterile solution over my lip into my container. If I was to reuse this cap would have to stay up the entire time. And then if there was still saline left in here, I would date, time, and initial. And it's good for how long?
24 hours.
24 hours if it's date, time, and initial. You walk into a room, there's saline in the room, and it's not date, time, and initial, what? Throw it away. What about the nurse and report just told you, hey, that saline over there, I just opened it up 2 hours ago. And you're in getting bedside. They actually went to the bedside like they're supposed to give you a report. What do you do? When she thanks, when she or he leaves, guess what? You throw it away. You can't trust them. It's got to be date, time, and initial. It's your license. It's the patient safety. Do you care about the $3 that you're saving in the hospital so much you're willing to give a patient an infection? Get new equipment. There's no more saline here, so I would throw it away. I'm going to fill it up with water and use it again because we're just practicing here. Okay, guys, don't throw any of your equipment away. This is the only equipment you get. So like when you guys are done, like I threw my wrapper away at the top of it. Get it back. You're going to tape it back on so you can do this procedure over and over and over again. Because once you practice, you only get one kit. Does that make sense? You see there's a double lip here, yeah? As long as I only touch between the two lips, I maintain sterility. Okay? So, I'm going to pull up the amount of fluid that I need. Okay? Well, let's say that's the ordered amount, which is 30. Okay? I can only touch the syringe between here and here. And I can touch the plunger. You guys okay with that? I'm going to start from the top, 1 inch apart. I'm going to go back and forth, just constant pressure, 1 inch apart, top to bottom, until it runs clear to the ordered amount of fluid or the ordered amount of medication. Once I've done that, and it might be 16 times I have to go back in and back out, back in and back out. So if I had to go back in, I would just do it again. Got another 30, right? So maybe they ordered 60, I would do it again. Top to bottom, 1 inch apart, back and forth, constant pressure. I've irrigated that left hip wound. You guys okay with that? Put this back in place. If this is daytime initial, technically it's good for 24 hours. I don't like that. I like to get new syringes and containers personally, but they're good for 24 hours also. Daytime to initial, so fluid and the container. And the container, daytime to initial.
So, do you do this procedure by yourself, or do you have someone's help to like carry the patient?
You can't just pick up your patient with one hand like this. You can't do it. They don't have a wound in the back or you can crack. Of course, Jennifer, you have 7 hours.
Okay.
Yeah, you might have 3 other people in there.
Okay.
Yeah, you can always take help. You never have to do anything by yourself if you don't want to.
Okay.
Always nurses that are slow on the floor that want to help out. Right, make friends with everyone, bring in cookies, whatever you gotta do, but you wanna make friends with everyone. Okay? You guys good with irrigating a hip wound? Okay. I'm going to pack the decubitus ulcer, but when I pack the decubitus ulcer, it's the same thing what I would do next with this wound. So what I do next with this wound is I would pack it or put a wound back in it. But what I'm doing is I'm gonna pack the decubitus ulcer, and so you guys can apply what I did there to the decubitus ulcer. Like I could have irrigated the decubitus ulcer, but I'm gonna pack that so you can see 2 different wounds getting worked on. Does that make sense to everyone? Okay. Hold tight while I set up for that. Any other questions that we can think of so far? Yep.
So if like you were ordered to irrigate it with a certain amount of fluid,
Yep.
but it's still running, like not clear, can you continue to keep going, or
Nope.
you just do it?
Yep.
Okay.
So the ordered amount of solution, ordered amount of medication to clear. Most of the time, it's just clear.
Okay.
Yep. Just that's the 95% of the time.
Okay.
That's the order that I've seen on my med surge floors. The hardest part about doing a wet to dry dressing is prepping for the wet to dry dressing. Again, in practice, do we ever do a wet to dry dressing sterilely? No. Right? The only sterile dressing change that we're gonna do is the central end. Why are you making us do it sterilely then, Tim? Because if you can do this dressing change sterilely, you can do any dressing change sterilely. You'll never get into a situation where a doc is there, I want that done sterilely. Okay, no problem. You'll never get in a situation like, I don't know how to do that, all right? Okay. So what I have here is I have my dressing care tray. This is inside your bag. Okay, again, you only get one of them. Wound care tray. Guys, read what's inside there so you know if you have what you need. Poly bag with twist tie. I'm not going to use that because the wound is already undressed. I have a drape. I have a combine dressing, which is your ABD dressing. That's that bandage. That's that big one that I put on top. It's called an ABD dressing.
ABD.
Or combine dressing. And ABD does not stand for abdominal, even though they even started to write abdominal on the dressing. It stands for Army Battle Dressing. It was invented by the military. I have tape, 2 different size rolls. I have a gauze roll. I have 10 pieces of gauze. I have a label. I have sterile saline. I have a measuring guide. I have vinyl exam gloves, 2 pairs. This is sterile. It's for single use only. It expires on 2020-11/30. So I have a whole nother year before it expires. The package is intact. The color looks good. Expiration date is appropriate. I have a suture removal kit because I need scissors. And the only place you can get sterile scissors in the hospital is inside the suture removal kit. The package looks good. The integrity looks good. The color looks good. And the expiration date is... I don't see an expiration date. So if you don't see an expiration date on your, like the kit, you need to go back to whoever's stocking your floor and it'll be on the box of the kits. Does it make sense? I have cotton tip applicators that I'm gonna use to pack my wound. Everything's the same. Expiration date, color, integrity. Good. I don't need this, and this already has gauze in it, so I'm gonna show you what you do if you don't have, your kit doesn't have gauze in it, so I'm gonna use this, okay? And then I have my sterile saline, even though there's sterile saline in there. You guys good with that? And by all means, you two are already doing it. You can record what I'm doing, guys. Get your iPhones out, or you guys can post to some type of social media for these people. Jennifer,
I
yes?
tried, yeah.
She said she'll try.
No, I mean, I tried.
If you can't see what I'm doing, you can't see, you better stand up and form a circle around me. Which means stand up and form a circle around me. All people in the back, short people in the front. You hand me my gloves. Guys, just like the skin hair nail assessment, I didn't say this earlier, but you'll catch on to it. I don't care what order you go in. You can go in that order any way you want through that rubric. It's in your brain, it's your rubric, it's your assessment. I just gotta make sure that you do it thoroughly. This procedure you can do in any order you want to do, as long as you maintain sterile technique. So I'm going to show you one way. You might see a video where it's done a different way. You might come to Open Lab where Professor James does it a different way. Okay. Pick the way. You just got to maintain sterile to sterile, non-sterile to non-sterile. I like to measure my wound before I even set up my sterile package. So I removed the dressing. I've medicated my patient. I've washed my hands. I've identified myself, explained the procedure, all that type of stuff. Would you come over here so you can get a better angle? Jennifer, you want to go over there too? Go behind. Billy will slide out of the way. They'll make a room for you so she can right in the middle and record. There we go.
Actually, I think this place is better.
You're fine, right there. Oh, actually, I know I needed that 4x4.
Can you see?
4x4.
Yep. All right, thank you. I
I
remember why I
posted in
had
the
that
group
out.
chat, by the way.
Thank you.
I've tried
Okay.
and it wouldn't do it.
So the first thing I do is I'm going to measure my wound. There are a bunch of different measurements of my wound that I need to do. I need to do width, length, depth. This wound has tunnel and undermining, so I have 5 different measurements I need. And then I either need to have someone in the room with me to write them down, okay, or I need to be taking my gloves on and off, writing them down as I go, okay, because I'm not going to remember 5 different measurements, okay. So we'll do the width is always side to side on the body. It's always lateral. So your width could be bigger than your length. Does that make sense? So if you had a long wound this way, it might be wider than it is with the length. The width is always head to toe, okay. So length is head to toe. The length of this is 10 centimeters. The width of this is 8 centimeters. So right now I'm 8 by 10. Next I need to do the depth. Okay. Guys, that's sterile, what I did. This is not sterile. Did I touch the wound? Did not touch the wound. The wound needs to be sterile. I'm okay. So what I did is still maintaining sterile technique. I've already checked all my expiration dates, colors, and integrity, so I'm going to pull this out. You agree that the top is not sterile, because my gloves are not sterile. But the rest of this is sterile, yes? I'm going to go down to the deepest part of the wound. It is 3.5 centimeters deep. You guys okay with that? These two are no longer good to be used. I like to clean up as I don't ever put my hands below my hips because when you have sterile gloves on, which I don't currently have on, I can't go below my hips, so I just practice never doing it. And then I clean up when I'm done. Next, you notice that on this patient man, he's so easy to turn around. 6 at 7 o'clock, he has a tunnel. For those of you with the camera, that's the tunnel. Okay, so I have to measure the depth of the tunnel. And then from, can't see my clock up there, from, I don't know, 10 till 2, let's say 10 to 2, right? Because the head's always 12, the butt's always 6, or the feet are always 6. So from 10 to 2, I have undermining. This is undermining. It's like a cave where miners go. That's a tunnel. This is undermining. You guys see the difference? I gotta measure both of those. So I'm gonna grab, guys, I always peel back and I hold it and peel back. What's the problem? Let's say because you have nurses that do this, they open it up, they come in here, they do this, and they're sliding this out. That could touch what my fingers just touched. If I want to maintain the sterility, I got to peel it back and hold it back. So because I didn't touch right there, and as I slide that out, it's protected. Does that make sense to you guys? So I'm gonna go into the tunnel. Guys, I've lost a whole entire cotton tip applicator. Like I didn't lose it, I held onto it, but like the whole thing went into a tunnel before. So don't be surprised when that happens. You got to act normal. If you go, the patient's like, what's wrong? Nothing at all. Right? Just like, oh, okay, cool. So the tunnel at 7 o'clock is 5 centimeters. The undermining. Why am I doing this? Trying to find the deepest spot. 2 centimeters. Guys good with that? Okay.
Do you measure every time you?
Great question. We don't usually anymore. We used to, and we realized we're not really seeing any progress except for once a week. So we usually measure once a week. At my hospital, it's on Mondays. Good question. In my, I need another set of cotton tip applicators. So inside of the Ziploc bag there, you'll see more. The Ziploc bag. Yeah, thanks. Okay, gloves come off. My gloves come off. What's the next thing I do? Hand hygiene of some sort. Okay. From there, I'm going to set up my sterile field.
Last one.
My last one?
I think so.
Okay. Thanks. It's okay. I only need. No, that's all I need.
Okay, we have 2.
Okay, thanks. All right, we already checked everything. I said, which way do you open stuff?
Towards you.
2 pairs of sterile gloves. I'm going to remove the sterile gloves. Okay? Then I'm going to put the sterile gloves on. I'm going to set up my sterile field. I'm going to remove 1 pair of sterile gloves and then use the second pair. I can do this entire thing with 1 pair of sterile gloves, but I'm not going to show it to you that way. But it is possible. Okay. So when I do that, students always get confused. So grab it like that. The outside of this package does not need to stay sterile. Do you agree it's not sterile?
Yeah.
Gloves are still sterile. And I was able to grab them without touching anything else that's there. Is it okay with that? And then anything else that I might need to be using during my procedure needs to get opened up now before I put my sterile gloves on, because the outside of this is not sterile, so I can't touch it with my sterile gloves. And I'm about to put sterile gloves on, right? So anything that I want to be added to my kit prior that I have to add to the kit. You guys see that? So I added that, and then I want to go ahead and add my
Opening at the wrong way.
You guys are on me, I love it. That's good. Guys, there's going to be tons of nurses that open them the other way, and they're not wrong. They're not. It is 100% within the right of practice to open that way, but just think about it logically. Which way seems safer? Because a lot of times in the hospital I miss, so I need like 2 kits of everything. I just miss. Okay, and I'm going to go ahead and open this up even though I'm not going to be, I don't need to use it because there's gauze in there, but I want to show you what you do if you're at a hospital where you don't have this kit. Ready to check the color, expiration, integrity? Missed you 2 pot. Again, I don't need to do that, but I'm going to show you guys how to do it if you don't have the stuff that I have inside my kit. Sterile folds always have to be above my hip, my waist. My hands go down here, and I'm looking at Billy, I can't see my hands. I can see my hands. So above my waist. As I open up my sterile gloves, you guys notice that I'm being very handsy with them, am I not? Please be handsy with your sterile gloves. You gotta break all the seams. If they start to fold back on themselves, you've broken sterile technique. With sterile fields, we say you can never grab the 1-inch border. This is the exception to the rule. You never get to grab the 1-inch border except for gloves that you're putting on because they come with a flap like this. After that, the 1-inch border does not get touched by sterile gloves. It does not get touched by non-sterile gloves. The 1-inch border does not get touched. It's a no-fly zone. Nothing can touch the 1-inch border of any sterile field, except for putting on gloves the first time. I pull really hard to make sure that they don't flip back on themselves. You'll see all the time, these will flip out, the nurses will do this, and then they'll flip out, and they'll hit the gloves, and they'll put back, and they'll put the glove. You broke sterile technique. They cannot flip back up, okay? Break the seams, take your time. Does it look like I'm in a hurry? Okay. With my non-dominant hand, I am right-handed. My right hand's gonna go behind my back, I don't need it currently. I'm going to grab the cuff. Okay, now I'm up off the sterile field. That cuff is ruled for a reason. This is called donning sterile gloves. These gloves are too small for me. Alright, you guys see what I'm doing with my other hand? Because I don't want to accidentally contaminate. Okay? Sterile to sterile. So 100% okay. Put all 4 fingers underneath there. Get this thumb away. You don't need this thumb. This thumb is useless. Don't do this. Too many of you guys do this, and when you go to put it on, you accidentally touch your skin. Don't need the thumb to put it on. Fonzie thumbs. Hey! Okay, Fonzie thumbs. I grab the middle of it. No. I'm so glad Kyrie left. That's the way he was shooting at the end of the game.
Facts.
So now I can grab stuff inside of here, right? I can't touch that 1-inch border, can I? If I want to move this, how do I move it? I don't get to touch the outside border. I can't touch the outside. You guys okay with that?
Mm-hmm.
I'm gonna have impasse here. I need the patient's not actually on the bed, so there's not enough room. Can you slide him that way? Just the patient.
No, just the
patient. Grab the butt. Slide him more. That's what's Guys, now look, I gotta be careful. There's 2 ways I can do this. If I do it this way, I can take my hand and actually put it down because I'm protecting my gloves. Most nurses don't do that. What they do is, and I know I've contaminated my gloves now because I touched the table. Most nurses do this and look where my thumbs are. Okay? Does that make sense? You guys see the slight difference, right? What I did the first time is, and I've broken sterile technique already because I keep on touching the drape. But what I do is I do this so that I can touch the table, so I can spread it out the way I want, right? What a lot of nurses do is they do this. And now their thumbs are at risk for becoming contaminated because A, they can't see their thumbs and they need to be able to see their thumbs, right? And then they could touch without even knowing. Like my glove could be touching the table and I could not feel it because it's the glove, right? So I always like to grab all my stuff. So I do stuff like this. Okay. The drape cannot hang over the edges. Like this is okay, but it can't hang over the edge where I can't see it. I need to be able to see everything that's in my sterile field. Then I'm gonna start adding stuff to my sterile field. It's enough tape to tape nothing. That's if I had taken off the whole dressing. Might have had it like bundled up onto chucks or something. I could throw it all in there. I don't need to do that. I don't need to measure. I already measured. Real life. 4x4s. Guys, it's a sterile package inside of a sterile package. Color, integrity, expiration date. You'll be surprised how many times you find a sterile package inside a sterile package that is expired. The first sterile package was not expired, but the second package that was inside the sterile package expired. Should be like an M&M song. Miss you too, Biggie. You guys think I'm an idiot? I love it. You gotta clean the lip. Gotta clean the lip. How you pour it on the floor if you want. Okay. You guys see what I've done here? If my kit comes with Curlex, I've done it inside this kit. Yes?
Mhm.
If it doesn't, I did it this way. I have the two exact same things here. Right? I'm just showing you how to do it both ways. If it comes with it, you can do it that way. If it doesn't, then you know how to do it. You get your own saline, you get your own Curlex, and it comes in a package like that. Okay. Okay, so now we're ready to pack it. This one's easier, so I'm going to do this one. Okay, because this one is like I can grab, I can get my hand in here. This is easy. It's easy to wring out. Okay. This one is a little bit more difficult. Holly, can you grab the bottom of that? Thanks. Set it down. So now, try my best not to make too much of a mess, but we make messes. And guys, I don't want to do it over top of the sterile drape because if the sterile drape gets wet, guess what? No longer
Non-sterile.
sterile. You gotta give the face. Okay. That is like after laying in the sun, then laying on my blanket, and then putting it in my car. Nope, they're still. Okay, got it. You want them to get really dry, because it's for debridement, guys. And then trying to, can you imagine trying to unroll and pack at the same time? Really hard. Again, you're not going to find this in a textbook somewhere, and this is Tim Myers' technique, and there's other ways to do it, I'm sure. Just the way that I've kind of taught myself how to manage the Curlex as I'm putting in the wound. So I unwind it all, and then I snake it back and forth. And this is sterile, my gloves are sterile, so I can do this. And now I no longer have to worry about trying to unroll and pack at the same time. Unrolling and packing at the same time is really hard to do. Okay, because we're going to do this sterilely. If I touch the skin with this, I've broken sterile technique. I can only touch the wound. If you're doing this as a test out, because it's one of the test outs, you're going to say, I broke sterile technique, I'm going to look at you and like, start over. You're going to tell me 12 times you broke sterile technique, I'm going to be like, okay, no problem, start over. You cannot fail, as long as you tell me what. You broke sterile technique, because in real life, can you break sterile technique?
Yes.
What do?
Start over.
So you cannot fail this skill as long as you can say to myself, I broke sterile technique. You want to loosely but fully pack the wound. It is a pressure ulcer. If you pack it too tightly, you are creating pressure on new capillaries. So you do not tightly pack the wound. You pack the wound fully to the top edge of the skin, but not beyond that. So loosely pack, but fully pack. Does that make sense? You do not want to be putting extra pressure on new capillaries. I packed the tunnel first, then I did the undermine, and now I do the body of the wound. Could you do the undermine before the tunnel? Sure. It's no difference. Could you do the body, then the tunnel, then the undermine? You could if you could figure out how. I don't know how you would do that. You could. Again, the order does not necessarily matter.
It's like surgery.
What's that?
It's like surgery.
It is like surgery. It's like Operation the Game.
Yeah.
Don't buzz. Oh, of course, I get a crappy person. Yes. Some of them are a little bit less crappy than others. Wound is packed. Whole point we're doing the wet to dry is to get it on that, right? So. All right. Primary dressing goes against the wound. Secondary dressing covers up primary dressing. Curlex is my primary dressing in this case. 4x4s are my secondary dressing in this place. In this case. Okay. Don't make it excessively thick. Moisture will create, and that can create more of a wound. Like a diaper. Billy was just showing around pictures of his daughter. How old now?
18 months.
18 months. So she's still in diapers.
Yes.
My son's 2.5. He's still in diapers. So hopefully soon he gets out of them. He's like he goes to the bathroom now when his sister goes. He's like,
That's
I go
good.
potty. I'm like, yeah, and he just sits there. I'm like, okay. I mean, she's so cute. She's like, push, Walter, push. Like, he's trying to. So we have the blue line here, right? So like a diaper has a thing that changes color when it's wet. Same idea here. It goes on the outside. My gloves are sterile, right?
Yep.
Everything is sterile, right? I'm not being sterile. Don't need to be sterile anymore. This tape was not inside my kit. This tape was sitting there by itself. And guys, remember that this is called a bandage. So we had the primary dressing, which was the Curlex. We had the secondary dressing, which was the 4x4. And we have the ABD, which is our bandage. The bandage holds the dressing in place. You could do a derm like I said before. Right? You could do that. What did I say? 30% on the skin, 70% on the dressing, bandage. 60-40, okay. 50-50, eh. Don't be this nurse. Do not be this nurse. I follow you, and I make fun of you in front of the patient as I'm ripping off butt hair because you didn't want to measure the size of the tape before you put it on. You weren't willing to do what I'm doing right now. Does it seem like it's that hard to do what I'm doing? And the patient's like, that hurts. I'm like, yeah, you're losing all your butt hair. I don't know why the last nurse put it on so thick. And then they let the next nurse know. When you do my dressing change this time, don't put so much tape on. Tim did a nice job. And then I was like, why do all the patients like you? I don't know. Because I use common sense. How do gloves come off? No? No?
Punch. Wrap up in a ball. Then underneath.
Hand hygiene. There's a pen. Pen? Pen? Marker, pen. I'm going to.
Oh, never mind, I got you. You couldn't write on anyway though, because it would be sterile, right?
I don't know what the day's date is. The 7th.
Is time
12.
in military time?
It is. I put MSN on mine just for you guys. Do you know what MSN stands for? Mean to Student Nurses. Masters of Science in Nursing. I don't ever put my PhD on stuff at the hospital because my PhD has nothing to do with what I do at the hospital.
Ta-da!
Okay, we have 6 butts. Between this room and that next room, I'll pass them out. Irrigate wounds. Dressing changes on the backside. You got to empty the JP drain. Got to put sterile gloves on. Those are 4 of the 37 skills that I have at the end of the semester that we just did. Okay? Go.